There doesn't seem like there is a month that goes by that I'm not reading the health benefits of consuming higher doses of vitamin D in my supplements. This month was no exception. A meta-analysis of 11 randomized, double-blind controlled clinical trials assessing the effect of vitamin D supplementation on the fracture risk in a pooled population, which involved over 31,000 subjects, was reported in the New England Journal of Medicine. They found that only the higher intake, or greater than 800 IUs, of vitamin D supplementation reduced the risk of fracture significantly in the elderly. The higher the supplementation was, the greater the reduction in fractures. They now recommend that you need to be supplementing your diet with at least 800 to 2,000 IU of vitamin D. These high levels of supplementation appear to reduce the risk of hip fractures by 30% and non-vertebral fractures by 14%. In fact, the researchers noted that this higher level of vitamin D supplementation showed decreased fracture risk for all ages of both sexes. Osteoporosis and osteopenia, that thinning of the bone, has been increasing significantly over the past 2 decades. It once was thought that this problem was just due to calcium deficiency, and most physicians simply recommended calcium supplements. However, today, we realize that nearly 90% of the adult population is considered to be deficient in vitamin D. Why is this important? Well, the fact is that you need adequate levels of vitamin D to absorb any calcium from the GI tract. If you have low vitamin D levels in your body, you just don't adequately absorb the calcium in your diet, no matter how much you're eating or supplementing. In fact, in my opinion, this has led to the consumption of too much calcium altogether. Once your vitamin D levels are brought back into an acceptable range, you'll absorb adequate amounts of calcium from your diet and supplementation, and your bone health improves. Therefore, the first thing I now do in my office, if I diagnose anyone as having osteoporosis or osteopenia, is to get a vitamin D blood level to be sure that it is adequate. I want to see their 25-hydroxy vitamin D level to be at least 60 nanograms per ml or 150 nanomoles per liter. Vitamin D supplementation is becoming a major aspect of nutritional medicine. It's not only critical for bone health, but also immune health and cardiovascular health. This is why I want to have all my patients supplementing their diet with at least 1,500 to 2,000 IU of vitamin D3, which is the most potent and best absorbed vitamin D in the marketplace today. When you take Ariix's Optimals each day, you are getting 2,000 IU of vitamin D3. This study simply shows another reason that this is so critical to our health.